this is Jill at the AAFE Training Center, and today we are treating Megan Lynn, who is one of our nurses here. We are doing standard level 1, level 2 Botox, so some more advanced Botox skills would be gummy smile. She has an asymmetrical gummy smile, mentalis, and then DAO. So come on in, we'll take a look. We already have her marked up. We treated her last 3 months ago, made a couple of adjustments to her dosing based on how she felt she responded to that last treatment. The thing we are actually adding on for today, which she has never had done, is her masseters. So I'll actually, if you want, I can mark those so that you can see the way that we mark the masseter muscle. You can come on in. So we know the masseter should be here along the side of the face, so I usually will have them clench, and this muscle is huge. You can see, relax, clench again. You can see it pushing my finger up. So you're gonna mark your anterior and posterior borders, and your injection site should be about 1 centimeter above the angle of the mandible there. And I'll show you how we inject those once it's time for injection. Relax, clench. Okay. All right, so we should be all set to go. So you can come on in, we'll start, I always start top to bottom, so we're starting with the frontalis. And we're treating just enough to treat this long, thin muscle equally. Alrighty, ready, Megan? Mm-hmm. So I like to pull the skin tight. I find that that helps the needle just glide into the right place. Always when you're wiping your injections, wipe up and away to prevent any migration of product to go downwards towards the brow. We adjusted Megan's frontalis dose the last time, dropped it down a little bit just based on complaints that she felt a little too heavy. So Megan, this dose seemed to have worked better for you last time, correct?
Yes.
Okay, great.
I'm somebody that likes a little bit of movement.
Okay. We did drop her glabellar dosing as well. She felt a little bit too frozen in between in this area, and that felt like she was having to recruit other muscles around there because this was too frozen. So we did drop her dose a little bit there. So always isolate that muscle. It's important whenever you're treating the corrugators that you're blocking off this orbital rim here. We never want any potential for product migration downwards, which could affect the opening of the eyelid. That would be referred to as eyelid ptosis. So moving on to crow's feet, this is a pretty vascular area, so important to try and look for any vascularities that we can avoid. You can see a vein running in through here that we'll try and avoid so that she doesn't bruise. As we know though, anytime we do Botox fillers, bruising should be expected. You should educate your patients about that. You can see we're using safe injection technique, always injecting away from the eye. We teach you all of these skills and more at our level 1 Botox training courses. And again, wiping away from the eye here. Turn towards the camera, please. Good. You can see she has a bunch of veins over here actually, so we'll do our best to avoid those. Try not to bruise patients if we can. Doing okay, Meg? Great, good. Wiping away from the eye. Alrighty, so we're gonna move down to the lower face. So the DAO muscle, Megan, can you point that since pull down? This is the muscle that is responsible for sort of pulling down the corners of the mouth. So when we give a little bit of toxin here, relax, we're hoping to get a little pickup of the corners of the mouth. It's very important that you know your anatomy here because there are other surrounding muscles that are quite close and we would never want to affect those on accident. So I always confirm placement again. Pull down for me. Good. So I know I'm right in the spot I want. Relax. This is a superficial injection. Because again, there are anatomical structures surrounding that we would never want to affect. Turn towards me. Good. Pull down. Relax. Good. Moving on to the mentalis. So the reason we treat the mentalis is for that sort of cobblestoning, like orange peel appearance of her mentalis. You can see here If you come in closely, when she makes this expression, you can see that cobblestoning appearance. So this will help that relax that mentalis muscle so that we can get a nice smooth appearance of the chin. You can also see this deep mentalis crease from the expression that she just made. And again, this will help that as well. This is a little pinchy, Meg. Okay, you doing okay?
Mm-hmm.
Alrighty, so for her asymmetrical gummy smile, give us a smile up close so that we can see here. You can see she has a little bit of gum show right here. So we're treating the muscle that's responsible for pulling up this upper lip in hopes to relax a little bit and make things a little more symmetrical. So we've already marked off, but I do like to confirm placement. Good, relax. And you're just feeling that muscle contract. And just a tiny, tiny bit of Botox there. And now onto the masseters. So turn towards the camera for me, please. Good. So I've already marked off where I'm going, but I'm going to have her clench and then relax. So this way I'm sort of catching that muscle right in between my fingers so I know I'm exactly where I need to be. And you go deep into the muscle and give it quick. And again for this side, and then we're all through. Clench, relax, good. That's it for Megan's Botox treatment. So in terms of post-op instructions, the most important thing, do not touch your face for 4 hours. We don't want that product migrating to any surrounding muscles that we might not want to affect. If possible, I like patients to avoid makeup the day of the procedure. There's a bunch of fresh injection sites and we just don't want those to become contaminated. Don't elevate your body temperature for 4 hours, so no exercise, sauna, hot tubs, or anything like that. Tomorrow you can resume normal makeup wear. Don't go home and lay down on your face. The most important thing is we really don't want to move that product anywhere, so just to be mindful of that. If they do have to wipe their face, they should wipe up and away, always away from their eyes. And again, in terms of the masseters that we treated here, always away from the mouth so that we're not taking a chance we might affect some muscles that are responsible for pulling our smile back. So thanks for watching. We hope you learned a little bit and we'll see you soon.